Asperger's syndrome. Asperger's syndrome is defined by its features: severe and sustained impairment in social interaction, development of restricted, repetitive patterns of behavior, interests, and activities. Impairment socially may be marked by multiple nonverbal behaviors. There may be failure to develop peer relationships appropriate to one's developmental level that may take different forms at different ages. And children have no interest in relationships, and adults have little idea of social interaction conventions. Autistic spectrum disorders such as Asperger's syndrome occurs in 1 out of 650 to 1,000 persons. More specifically, Asperger's syndrome occurs in 1 in 10,000 people. Asperger's syndrome is up to 10 times more common in males than in females. Although it has often been considered to be a disorder, it would be better to describe it as a personality style because of the fact that people who have it tend to be social loners. The condition, now known as Asperger's syndrome, was first described by Hans Asperger in 1944. He identified a group of patients who had severe and characteristic difficulties of social integration. In 4 boys, he identified a pattern of behavior and abilities he called autistic psychopathy, meaning autism, self, and psychopathy, personality disease. The pattern included a lack of empathy, little ability to form friendships, one-sided conversation, intense absorption in a special interest, and clumsy movements. Asperger called children with Asperger's syndrome little professors because of their ability to talk about their favorite subject in detail. A pervasive development disorder, Asperger's syndrome is a pattern of symptoms rather than a single symptom. It is characterized by qualitative impairment in social interaction, by stereotyped and restricted patterns of behavior, activities, and interests, and by no clinically significant delay in cognitive development or general delay in language. Asperger's syndrome reflects deviations or abnormalities in 4 aspects of development: social relatedness and social skills, the use of language for purposes of communication, certain behavioral and stylistic characteristics such as repetitive or perversing features, and limited but intense range of interests. Common traits of people with Asperger's syndrome include poor choice of words when speaking, motor clumsiness such as driving, which is a huge difficulty, nonverbal communications like gestures, facial expressions, casual contact, etc., and social interaction, which is the most noticeable difficulty. Physical traits are rarely seen besides in adolescence and adult life when an inappropriate gait is seen. Posture and facial expression also produce an impression of oddness. While genetic factors are believed to contribute to the development of Asperger's syndrome, no related genes have been confirmed. It is unclear whether certain gene variations that are being studied in other autism spectrum disorders will play a role in Asperger's syndrome. It appears likely that a combination of genetic variations and environmental factors influence the development of this complex condition. Psychological effects of Asperger's syndrome include an inability to fully comprehend social structures. Those with Asperger's syndrome cannot handle change in routine. They face a lack of interest in certain situations. They're more prone to anxiety. They have a very literal interpretation of certain phrases. They're unable to display emotions very well, and they have anxiety caused by physical touch. Other psychological effects from Asperger's syndrome include their focus on concrete object relations, and they're very technical in their brain functioning. They're able to relate to mechanics and physical relations very well, and they excel in maths because they're very able to think of things that produce a desired result that is very uniform. There's much success with Asperger's syndrome, such as some people with Asperger's syndrome have very advanced vocabularies. They're able to recognize hidden patterns that others are not able to. They're not easily swayed by others' opinions because of their lack of social conventions. They're able to be more studious because of their lack of need for social interactions. They are able to be more introverted and work on their studies about themselves. And they see the world differently and provide a different perspective, which is always necessary in this day. And they are very sincere, truthful, and dependable, which makes a great employee. For social implications, they are unable to connect information they have acquired socially to carry into future interactions, which may be very awkward for them. They are more difficult to make friends. They are unable to predict behaviors and responses, so conversations they had earlier and how they responded would be bad for them. And also jokes is not that good for them because they don't know who's going to laugh at a joke or who might be offended by a joke, and so they just really need to stray away from that entirely. They assume everyone is like them and find it hard to relate to other cultures or customs, which is very difficult, and typically they're classified as socially awkward. How it's diagnosed: if symptoms are present, a doctor evaluates by performing a medical history check and a physical exam, and if there are no tests specific to Asperger's syndrome, so a doctor may run various tests such as x-rays or blood tests to see if there's a physical disorder that causes the symptoms seen, and if the disorder is not specified, a patient may be referred to a specialist. In the specific case of children, a specialist in child development is most often referred to, and this doctor bases his or her diagnosis on the child's level of development. Observations are made on the child's speech and behavior, including his or her ability to socialize with others. There's no true cure for Asperger's syndrome. Treatment strives to improve those with Asperger's syndrome and their abilities to interact with other people. It focuses on helping them function effectively in society and being self-sufficient. The keys are self-advocacy, clearly communicating interests, desires, needs, and rights, and also adopting a systematic techniques for identifying and accomplishing specific missions. Asperger's syndrome has differences in the number of severity of symptoms, so treatment must be designed to meet the individual's specific needs. And this is my bibliography.